Let me now turn to kind of chapter 2 for today. Related, but a different area. We are now at yet another critical juncture in our battle against the coronavirus. Someone likened this to being in the second inning of a 9-inning game. I'm not sure what inning we're in, but it's still fairly early. What we're seeing, of course, as you can see in headlines across the state and on the news, on TV and radio, that the virus once again is spreading with a vengeance across many parts of the country and across parts of Ohio. In this next phase of the pandemic, saving lives, protecting our fellow Ohioans remains top priority. We cannot move backward. Ohioans have come too far in this fight to cede ground now to this virus. Our best defense moving forward is to be on the offense. This means that this next phase is not about hunkering down, but about learning to live with the virus. And so I'm calling this phase, and we'll continue to call it, how we live with this virus. We have to be smart about it. We have to be careful about it. We have to understand that it's important for health reasons and important for all kinds of reasons that our economy move forward and that we not go back in regard to our economy either. Doing both, keeping the economy moving and keeping safe, these are consistent, and one is certainly dependent upon the other. Learning to live and learning to function and to keep an economy open and moving, all the while taking active measures to slow the spread of this very infectious, deadly disease until we have a vaccine or other effective treatments that are widely available to all Ohioans. These are our goals. I will talk, and have talked in the past, about the testing, which is a very essential part to this. Going forward, we will maintain vital, necessary baseline orders. So the orders that we had issued are about to run out. Those baseline orders for all Ohioans as far as distancing, as far as businesses. You heard me reference a few minutes ago about employees in a school district basically having the same as other people in industry and in retail. Those all continue. So those are baseline orders. But we have also developed a new warning system, and we're going to unveil this warning system today. We're calling it Public Health Advisory Alert System. Public Health Advisory Alert System. This will provide local health departments. It will provide community leaders. It will provide me. It will provide state leaders, members of the legislature, data and information that will enable us to then layer additional enhanced safety measures to combat flare-ups as they occur in different parts of the state. One of the messages that I have heard from members of the General Assembly and members of the public is that we should start looking at the state, different counties, differently. And so what we have come up with, we're announcing today, is a way to do that. It's based upon that we have a premise that we have some things in common. We all need to wash our hands. We all need to keep social distance. We all need to wear a mask when we're out in public, a recommendation, a strong recommendation. When we're working, we need to follow that guideline to wear a mask. But that as we start to look at the state beyond that, we look at what's happening in each county. Now, we know that the number of COVID-19 cases is rising dramatically. We've seen them climb over the last 3 weeks. 412 on June 17th. June 24th, that number had risen 632. Yesterday, on July 1, over 1,076. This is a worrisome and concerning trend. and we're going to continue to watch these numbers. Our COVID-19 experts say that there's likely community spread in every Ohio county. In fact, there are only a few counties in the state that have not reported cases in the past 2 weeks. However, that does not necessarily mean that they don't have any cases at all, because as we know, the number of people who are not yet showing symptoms or may show only mild symptoms that doesn't show up on a test or don't get tested is significant. Local health departments are mapping the virus transmission. They've reported to the Ohio Department of Health information about how COVID-19 is spreading. And this is anecdotal, and we're going to continue to drill down and get you better information about how it is spreading. But this is a summary of what we're seeing and talking to local health departments and then of course they're relying on what they tell us based upon what their tracers are telling them when they talk to individuals who have been infected. And these are just some of the ways it is spreading. It's spreading at large family gatherings, such as birthday parties, graduation celebrations, funerals, other large gatherings, such as protests where people are gathering. Shouting also present a particular risk. The virus is spreading in some cases at the workplace, although, again, most employers are doing a phenomenal job, but in some workplaces it is spreading. It's spreading in bars and restaurants. It's spreading at tourist destinations, Put-in-Bay, for example. It's spreading because people who are showing symptoms are not staying home when they should. It's spreading because people aren't social distancing and they're not wearing masks. Many of these cases, as we know, involve younger Ohioans in their 20s and 30s, and this is a national trend. People are letting their guard down, and all the great actions Ohioans have taken to this point are in danger, frankly, of being reversed. Our public health advisory alert system will help make clear the very real dangers happening in individual counties across Ohio. This is a color-coded system built on a data-driven framework to assess the degree of the virus's spread and to inform, to engage, and to empower individuals, businesses, communities, local governments, and others in the appropriate response and action. Again, our belief is more information is better. The system consists of 4 levels that provide Ohioans with guidance as to the severity of the problem in the counties in which they live. The levels are determined by 7 data indicators that identify the risk level for each county and a corresponding color code to represent that risk level. First, though, we must remember that there is a baseline risk to everyone in every county, community, every single day. Then you add to that baseline an ever-present risk. Add on top of that all the data that we look at each day. The more data indicators that are present in a county, the higher the risk level. These data indicators, fall into 3 main categories: case symptoms and hospitalizations. Most of these data sets look back over 3 weeks, a 3-week period of time, since it may take up to 2 weeks for an individual to start showing symptoms at all. So let me start by talking about the case indicators. We have 7, and we hope to add 3 more when we can get that appropriate data. Indicator number 1, new cases per capita. When the data shows that a county has had an average of 50 cases per 100,000 people over a 2-week period, that will trigger a flag for an increasing case rate. Using this data point means we are taking into account the population of a county when monitoring case increases. We're using this specific threshold because this is the point at which the Centers for Disease Control and Prevention define a population's case rate as going from moderate to moderately high. We think that's a significant number. Number 2, we look at the sustained increase in new cases. If the number of new cases in a county continually increases for a series of days, that's another indicator of virus spread. A county will be flagged for meeting this indicator if the data shows at least a 5-day period of sustained new case growth. Our third indicator, proportion of cases that are not congregate cases. And again, in this one, we are in this formula downplaying, to some extent, what's going on in congregate care. We know that the risk of spread within congregate settings, such as long-term care facilities, prisons, is high. But those in these facilities generally are less likely to transmit the virus to the general public. That's why we must give more weight to non-congregate cases when we're looking at community spread. When we begin seeing a large number of positive cases from those living in the broader community, that is a big concern. Data showing more than 50% of new cases originating from non-congregate settings during at least one of the past 3 weeks will trigger a flag on this indicator. Now, let's move on to 4 or 5. Again, let's look at symptom indicators. The next two that I'm going to tell you about monitor the incidence of illness using data from emergency departments and outpatient settings, including telehealth appointments. So again, these are early warning, what I would call early warning indicators. They don't have really anything to do with the cases. They're before you would ever record a case. But this is an early warning system. That would include indicator 4, sustained increase in emergency room visits. Emergency room data will show us the trend in the number of people who visit an emergency department with COVID-19 symptoms or a COVID diagnosis as a result of the visit. A county is flagged when there is an increase in ER visits over a 5-day period. This data is also important because it gives us an idea of the number of people whose symptoms may get worse and may need a hospital bed in the future. Number 5, also an early indicator, sustained increase in outpatient visits. Similar to the previous indicator, this data looks at the number of people visiting outpatient settings, including telehealth appointments, with suspected or confirmed COVID-19 symptoms. This data helps us understand how many people are sick enough to go to the doctor's office. Very interesting and very important. And as with emergency room visits, this can be an early warning indicator for future hospitalizations. A county is flagged when there is an increase over a 5-day period. Now, let's go to the last two, 6 and 7. Let's look at hospitalization indicators. The next two indicators focus on the number of people in a county who are seriously sick with COVID-19, sick enough to go to the hospital, and are ultimately admitted into the hospital. So now indicator number 6, sustained increase in new COVID-19 hospital admissions. This data shows the burden of COVID-19 in the community. When the numbers show at least a 5-day period of sustained growth in the number of county residents with COVID-19 who are admitted to a hospital, the county will be flagged for meeting this indicator. To be clear, this measure looks at the county of residence. So if someone lives in Vinton County, for example, someone lives in Delaware County, and their hospital is in Franklin County, what gets recorded on this one is the county where they come from. So it does not skew the numbers. This measure looks at the county of residence rather than the county of hospitalization, since residents may seek care at hospitals in other places than their home county. Number 7, the final one that we're using, intensive care unit ICU bed occupancy. One of the challenges of treating COVID-19 patients is the long period of hospital care or ICU care that is often required. While new hospital admissions tell us the new burden of illness in a county, admissions do not tell us the resource burden on the hospitals in the broader region. This indicator looks at regional data for both COVID and non-COVID use of ICU beds. So it's just like we're filling it up, and it gives us an indication of how full we are in our hospitals. A county is flagged for the indicator when the regional ICU occupancy goes above 80% for at least 3 of the last 7 days. We're also looking, again, that one is based on that particular county, the hospital is. As I told you, we're also looking to refine these measurements. I'll just mention quickly, we have 3 other ones that we will be using, we hope, once we get the data and we can put it online and it's usable. Contact tracing, we'll get some data from that. Test per capita and percent positivity. So those will all be coming. Now, how do these current indicators then inform the different alert levels in our public health advisory alert system? Let's start with a basic fact. Our data team thinks all 88 counties have community spread. Let's start with the first alert level, the lowest. An alert level 1. We identify this on the map as yellow. This will be level 1. Identified as yellow, a county has triggered 0 or 1 of the indicators, 0 or 1 of the indicators. And there is active exposure and spread. Today we have 53 counties at alert level number 1. So the yellow counties that you see there are the counties that are today at alert level number 1. And let me just say that it is our intention, unless there's something strange going on, to do this once a week. We look forward to doing this on Wednesday and would probably announce those at our news conference on Thursday. But that work would be done on the Wednesday. We wanted to get in the middle of the week. For some reason, data on weekends just doesn't give you the trend lines, and you need to see it more towards the middle of the week. The majority of these counties are seeing a moderate number of cases, according to the CDC's definition. Some are seeing a steady increase of cases each day, but not necessarily a rapid spread. And I caution you, though, if you live in one of these counties, we should not have a false sense of security. Many of these counties do have, certainly these counties do have, we believe, community spread. At alert level 1, all current health orders and sector guidance should be followed, as they are in all levels, including guidance for business and mass gatherings. On an individual basis, all Ohioans should continue to take appropriate health and safety precautions, including conducting daily health and symptom assessments, staying home when sick, and contact your medical provider for advice, maintain social distance of at least 6 feet, wear a face mask or covering while in public, exercise increased caution when interacting with others who are not practicing social distancing or wearing face coverings, avoid travel to high-risk areas, and practice good hygiene such as regular hand washing. So you'll find those recommendations on all 4 levels. So we started with the yellow. Let me go to level 2, which we're identifying as orange. This will be the orange level. A county has triggered 2 or 3 of the indicators, and there is increased risk of exposure and spread. We have 28 counties now in this category. These counties are seeing cases that are growing in the community in the last 2 weeks. In these counties, you're seeing more people go to the doctor or emergency room because they are experiencing symptoms and they want to see whether or not they have the virus. Ohioans in level 2 counties should exercise a high degree of caution. And as with every level, all current health orders and sector-specific guidance must continue to be followed. Furthermore, Ohioans should continue to follow these guidelines outlined in level 1, as well as avoid contact with anyone considered high risk, decrease your in-person interactions in general, and seek medical care as necessary, but limit or avoid unnecessary trips to visit people in a hospital or a nursing home or residential care. Just try to limit those. And so those are the counties, as you see, that are at the orange, what we're calling the orange level on there. Let's move now to level 3, identified as red. This is red on the map. A county has triggered 4 or 5 of the 7 indicators, and there's a very high exposure and spread. There are currently 7 Ohio counties at level 3. In these counties, risk is very high. Ohioans should limit activities as much as possible. Wear a mask when you go out, for sure. Consider online options, perhaps even for church services. Many cases of community spread are present in these counties. There are typically multiple outbreaks at any given time in different settings, such as workplaces, social settings, long-term care facilities. COVID hospitalizations for both ICU and non-ICU stays are trending up in some of these counties. Again, all current health orders and sector-specific guidance must continue to be followed. At this level, all Ohioans should continue to follow those guidelines outlined in levels 1 and 2, as well as consider necessary travel only. Only necessary travel out of your house, and limit attending gatherings of any kind. Let me go to the level that's not on here. Thank heavens. An alert level 4 we identify as purple. A county has triggered 6 to 7 of the indicators, and there is severe exposure and spread. All current health orders and sector-specific guidance must continue to be followed. Ohioans living in counties at this level should continue to follow those guidelines outlined in levels 1, 2, and 3, as well as stay home as much as possible and only travel if necessary. We have no counties at the purple level. But I want to point out, and you will, Eric, if you could put that back up there, you will see, and we'll get to it in a minute, but Franklin County. Franklin County is now on the watch list. Franklin County is on the watch list with a grave concern that it could be moving from red to purple. Let me go through the red counties. Trumbull County, and this what the data team is doing for me, what they're doing, and we'll hope to provide for every county so it can be used by local officials. And again, we welcome and we'll be reaching out to local officials, the health people in those counties to find out specific things that may not show on the data or that they can help interpret the data that we are seeing. That is a process. In addition to multiple outbreaks, I'm back to Trumbull now. In addition to multiple outbreaks in congregate settings, Trumbull County also currently has an outbreak in a health care facility. Trumbull County has now met 4 of the 7 indicators we're using to assess the risk for the spread of COVID-19. Indicator 1, new cases per capita. Indicator 3, proportion of cases that are not congregate cases. Indicator 4, sustained increase in emergency room visits. And 5, sustained increase in outpatient visits. They have 4 of the 7. Average new cases per capita in Trumbull County have doubled, and the average number of ER visits has tripled. Huron County, by far our smallest county, up on the red. We're seeing a spike in Huron County primarily because of agriculture workers. Workplace outbreaks, several outbreaks at farming operations. It's important to remember that workplace outbreaks are not just isolated to those settings, but certainly are indicators of community spread. Huron County is meeting indicators 1 through 5 in the following ways: new cases per capita, sustained increase in new cases, proportion of cases that are not congregate cases, sustained increase in emergency room visits, sustained increase in outpatient visits. So they have 5 of those qualifiers. For new cases per 100,000, Huron County has reported 130 cases during the last 14 days, which sends them past the CDC's moderately high threshold and are now in the high incident category. Their average number of cases per day are up, more than doubling in recent weeks. ER visits are up, and outpatient visits are also up. Let me move now to Southwest Ohio and Montgomery County. Like Huron County, Montgomery County is also in the CDC's high incident category. More than 80% of the cases are linked to community spread. More than 80% of the cases are linked to community spread, not congregate settings, signaling significant transmission in the broader community. Community outbreaks have been tied back to settings such as workplaces, a child care center, a faith-based organization. Montgomery County meets indicators 1 through 5, which again are new cases per capita, sustained increase in new cases, proportion of cases that are not congregate cases, sustained increase in emergency room visits, and sustained increase in outpatient visits. Here we've seen average daily visits to the ER more than double. Outpatient visits have more than quadrupled. And the West Central region, the region where they're in, the number of COVID-positive patients in the hospital or on ventilators has doubled in the last few weeks. Let's go down south of there to Butler County. Butler is meeting 4 of the 7 indicators. New cases per capita, sustained increase in new cases, proportion of cases that are not congregate cases, and sustained increase in outpatient visits. As of this past week, the average new cases in Butler County per day doubled. This increase is not simply due to increased testing. The other healthcare data suggests otherwise. Outpatient visits in Butler County have nearly doubled, and the number of COVID-positive patients in the Southwest region's hospital beds and ICUs have also doubled since the second week of June. Butler County's recent outbreaks include a retail store and a long-term care facility. Let's head back up north to Cuyahoga County. While many of Cuyahoga County's cases during the last 3 weeks have been within congregate settings, the county still has a growing number of cases outside of those settings, indicating that the risk of continued community transmission is high. Right now, Cuyahoga County has met 4 of the 7 health care indicators. Indicator 1, new cases per capita. Indicator 2, sustained increase in new cases. Indicator 4, sustained increase in emergency room visits. And Indicator 5, sustained increase in outpatient visits. Cuyahoga County's total number of cases with the onset dates during the last 2 weeks rose higher than any 2-week period until now. Their average number of daily cases has more than doubled. The average daily number of ER visits has doubled, and outpatient visits have tripled. We'll go back south down to Hamilton County. Hamilton County had been holding steady at the end of May and into early June, with an average of 30 new cases a day. That changed this past week. New cases each day have quadrupled to approximately 130 cases per day. Right now, Hamilton County has met 5 of the 7 healthcare indicators. Indicator 1, new cases per capita. Indicator 2, sustained increase in new cases. Indicator 3, proportion of cases that are not congregate cases. Indicator 4, sustained increase in emergency room visits. And Indicator 5, sustained increase in outpatient visits. ER visits have nearly tripled, and the number of people diagnosed with COVID-19 after visiting their doctor has more than tripled. Recent outbreaks are happening at workplaces, in a faith-based community setting, and in business. In all, Hamilton County has seen a high percentage of its cases outside of congregate settings, ranging from about 89% to about 97% over the last 3 weeks. Now, let's turn to Franklin County. Again, Franklin is red as the other ones I just read, but there's a special concern, and we have them on what we're calling a watch list. Franklin County's growth in number of new cases, 1,500 in the past 2 weeks, is explosive. It's explosive, with much of the growth occurring in the last 7 days. Franklin County has a star on it because it's the top of our watch list right now, meaning it's high red and close to meeting a 7th indicator, which would bump it to alert level 4, which is the highest level. Right now, Franklin County has met 5 of the 7 health care indicators. Indicator 1, new cases per capita. Indicator 2, sustained increase in new cases. Indicator 3, proportion of cases that are not congregate cases. Indicator 4, sustained increase in emergency room visits. And Indicator 5, sustained increase in outpatient visits. We did not mention, as you'll recall, the other day, I talked about several counties and did not talk about Franklin County. These numbers are just emerging very, very, very quickly. Franklin County has gone from 81 new cases a day to 124 a day in the last 2 weeks. Cases per 100,000 residents over the last 2 weeks is 123. That is higher than the CDC's high definition of 100 new cases. In fact, between Monday's press conference and yesterday, Franklin County had more than 350 newly reported cases. Add to that recent outbreaks in an apartment complex, manufacturing facility, and a child care facility. For the past 3 weeks, more than 80% of the cases have been outside of congregate settings. Outpatient visits have spiked. In recent visits, the ER have more than doubled. So we're watching Franklin County very carefully. Finally, regardless of the alert level, we should highlight 2 important additional points. High-risk individuals. This is being defined as roughly 60% of Ohio's population. They are at an increased risk of severe illness, should take every precaution to guard against contracting COVID-19, including following guidelines at higher risk levels. To better understand your own individual risk, of course, consult a doctor. Second, Ohioans should assume that if one member of their household is sick, then every household member should be treated as if they're sick. That means taking appropriate measures to control the spread, which should include self-quarantining and contacting a doctor.